A lot of emotion in that aspect. We've also seen a lot of never before seen video of the attack on January 6th. And these four officers, they say that on that day, they thought they were going to die.
It seems that there's a lot to talk about, and we mostly just
in the
want to make
first
sure we're
select committee hearing to investigate the Capitol insurrection, responding officers delivering emotional testimony.
January 6th,
general items,
for the first time,
information and
I was more afraid to work
and I'll be very happy to answer questions.
in my entire
for those of you on the phone, remember you're all muted
describing
right now.
the violence
star 6
in vivid
to
detail.
unmute when it's time to ask questions, and then we would ask you to star 6 again to mute yourself
all while being called
to
a
minimize
traitor
the
to my
background
country.
noise.
The 7 Democrats and 2
so
Republicans
let me,
of the committee are investigating the security
run through,
failures
a few
that allowed the
items.
Capitol to be breached and the
issue
political
that is
forces
going on
behind the
in
riot.
Alabama now,
We need to
are
understand how the
seeing
rotten lie
significant
behind
jump in
January 6th has
hospitalizations.
continued to
We,
spread and feed the
believe that,
forces that would undermine
much of that is
American
due to
democracy.
the Delta variant.
But
although
Congress
we don't
does not
necessarily
act
have numbers
responsibly.
to prove
This
that
will
at this
remain
time,
a
but certainly
cancer
that's what's been
on our
seen nationally, and
constitutional
certainly
republic.
The bipartisan
the
effort facing criticism from
increase
some
in
House
our numbers
Republicans
of
over the
cases,
makeup
in
of
particular
the
number of
committee.
hospitalizations
Speaker
would
Pelosi
be
will only
consistent,
pick on people
with
onto the
that.
committee
We
that will
have more
ask
than
the questions she
900,
wants asked.
COVID patients
That
in
becomes a
Alabama
failed
hospitals
committee and a
today
failed report.
across the state.
But officers say
We've
they
not
feel
seen
betrayed
numbers
by
like
the
that
very
since,
people they serve to
February.
protect and are demanding
I
the
would
truth.
remind you that
Nothing,
on
truly
the
nothing,
4th of July weekend,
has
I think
prepared
on
me
July
to
3rd,
address
we
those
had
elected members of
179
our
patients in Alabama
government who
hospitals.
continue
So we're
to
now,
deny the events of that day,
3.5 weeks later, and
and
we're
in
over
doing so,
900. So
betray their oath of
we are
office.
still far below, I guess, the peak that we saw in
Daniel
December,
Hodges,
January,
who
where we had,
was beaten and also suffered a concussion, and he really thought that he was going to be lynched by the mob on that day. Now, we do know that this is overall after today, this is going to lay out a roadmap for the committee on exactly how to attack their investigation moving forward. And speaking of their investigation, the Department of Justice announced today that they will allow former DOJ officials to testify on former President Donald Trump's actions leading up to January 6th.
Right now who are age
Live
12
in
and
Washington.
older and therefore
Bill
eligible
Fortress.
to be vaccinated. We've reached about 45% of that group, 1.9 million of that group who've received 1 or more doses now in more than 1,400 locations around the state. You can get a vaccine today with no appointment and virtually no waiting in multiple locations in every county in the state. And we would encourage people to please take advantage of that as soon as they can. We are aware that our death numbers fortunately have not crept up significantly yet, but I think past experience has taught us that that is what happens next. We have typically seen jumps in cases followed by jumps in hospitalizations, followed soon thereafter by jumps in numbers of deaths. So we are not looking forward to that happening. But we do expect that. We know that people who are unvaccinated are accounting, to the best that we're able to calculate, they're accounting for most all of our new COVID cases. Hospitals have reported that virtually all of their hospitalizations, certainly well over 95%, but probably closer to 99% of their hospitalizations are occurring in unvaccinated people, and our deaths overwhelmingly are occurring in unvaccinated people. I'll give you some specific numbers on that in just a little bit. We have much lower vaccination rates against young people. People 50 and up have done a much better job. I think we've reached more than 75%, between 75 and 80% of all Alabamians age 65 and up. Our rates in those who are younger are definitely much lower. If someone has been vaccinated with their first dose and not completed their series, it is not too late. It is never too late to come back and get your second dose, so please seek that out. That will give you the best available protection. People will enjoy some degree of protection with a single dose of the 2-dose regimens, but a second dose affords better protection, and it is not too late to get it. No matter how long it's been for you, we would encourage you to go back and get that. Let's see. I want to say a few things about masks. As you know, CDC is expected to issue new guidance soon about mask wearing. I would say here in Alabama, our guidance hasn't really changed that much. That is, we have continued to encourage people who are unvaccinated to wear a mask in just about every situation. For people who are vaccinated, masks are optional. There are certainly a lot of situations in which wearing a mask makes a lot of sense, even if you're vaccinated. For people who are vulnerable because of their age or their other medical problems, it makes a lot of sense to wear a mask, especially if you're indoors, certainly if you're in groups of people, certainly if you don't know other people's vaccination status. The guidance we expect from CDC will include some I think more explicit language about even vaccinated people wearing masks in a lot of situations. That's what we expect they're going to say. I would say that makes complete sense. The reason that this guidance has changed is that when CDC last issued guidance, which was back in May, which said vaccinated people generally don't need to wear masks, the Delta variant just wasn't a thing that we were aware of. And so as the science changes, the recommendations change too. I know that can be frustrating for the public. People feel like that we're flipping back and forth, and certainly you can understand why they would feel that way. But in fact, the real world situation has changed, and that sometimes means that we have to make sure we're giving the best available guidance that we can to people. I certainly, just because it always gets asked, I certainly don't think there's going to be any type of state mandate or requirement for people to wear a mask. There are some situations in which the federal government requires that, including public transportation. There are healthcare facilities that are under federal rule that allows them to wear masks. Certainly private employers or schools or others are capable of or empowered to make those decisions for themselves. The state of Alabama doesn't have a plan to do that at this time. As the governor said, we expect people to make good decisions. It's up to them to do what they need to do, and I think everyone's aware of what they need to do. Our isolation and quarantine guidance has not changed. If you are a person who's infected with COVID, then you have to isolate based on the same rules that we've had before. We still have quarantine guidance in place, or quarantine rules in place for people who are counted as close contacts. That did not go away when the state of emergency ended. That's just part of our notifiable disease rules that all public health agencies have. Those are the same rules we apply if we had a tuberculosis case or a measles case or a whooping cough or anything else. The same notifiable disease rules apply. The quarantine and isolation guidelines still applies. So if you are a close contact, then you need to quarantine in keeping with what our guidance says. Let's see what else. Just a few specifics on vaccines. Let me see if I can put my hands on it here for you. Again, so as of today, we have vaccine available in 1,408 locations, 1,408 locations. That includes multiple clinics, county health departments, federally qualified health centers, hospitals, long-term care facilities, pharmacies, rural health clinics, many other sites as well, things like dialysis centers and other health-related facilities, all have vaccine available. We have given a total of about 3.398 million doses, total doses. I gave you the numbers on vaccinated people a little while ago. We have had some wastage. Some of that wastage has just been normal wastage when you can't use a vial that's been opened. Some of it has to do with expiration dates. We've have counted as wasted about 35,017 doses of vaccine, 35017 doses of vaccine that have been wasted so far, as compared with the 3.4 million doses that we've given. I mentioned to you that the Delta variant continues to circulate. We believe it's circulating widely. We found it in all parts of the state wherever we have looked. We are, like a lot of states, are still ramping up our ability to do the genomic sequencing that's necessary to do that. We get questioned by the public a lot. There's not a type of COVID test you can go get to find out if you have COVID that is necessarily going to give you what kind of variant you have. That's a separate test that we would do on a clinical specimen. It's done by certain types of laboratories. We have those taking place in places like Birmingham and Huntsville and Mobile area, as well as our state lab here in Montgomery. We're trying to increase those numbers. We most recently have a little over, a little over 200 Delta cases that we have identified, but again, CDC reported a full week ago that about 83% of new cases in the country were the Delta variant, so I don't really think Alabama's likely to be any different there, even though we're still working on that. Schools are going to be starting very soon. Obviously, that is an area of concern as you start bringing people from multiple households back together, particularly those kids under age 12 that don't have the opportunity to be vaccinated. I think it's inevitable that we will see some outbreaks. We recognize the reality of that situation. We also feel very strongly kids need to be back in school in person. CDC has continued to issue its guidance about being safe in schools and about distancing and about hygiene and sanitation and all those issues, and yet CDC also says that those non-pharmaceutical interventions aren't reasons to keep kids out of school. We want to get kids back to school. The issues of masks in school are, like everything with masks, highly controversial. They really shouldn't be. Masks are a very effective way of preventing disease transmission. They protect the wearer from others, but they certainly protect a person who may have COVID unawares from transmitting it to other people in a lot of cases. We are publishing our school toolkit later this week, just an update of the same document we had last year with newer guidance. The guidance essentially allows for kids to be spaced at 3 feet apart as long as they're consistently wearing masks and doing all the other things that we would ask them to do. Kids who are exposed to a case in school, if they are wearing masks and they're following all these other guidelines, don't have to quarantine. They're not counted as a close contact. If they are vaccinated, if they're otherwise doing things that they can do. There's certainly concern about adults and others in schools. Remember, schools are not just full of kids, but schools are full of adults as well. We certainly encourage everyone who's in a school setting to be vaccinated if it's possible for them to do that. We also understand that not everybody is, and for those who are not vaccinated or are perhaps unable to be vaccinated, we do continue to recommend mask wearing in those situations. Ultimately, those decisions are going to be left to local school boards. Those decisions aren't going to be made by the state, but our public health guidance is that mask wearing ought to be done by those people who aren't vaccinated. That guidance has not changed. That's been the same for well over a year now. Let's see. We continue to work on our messaging to try to reach people who are hesitant. It's certainly not our intent to blame people or shame people or try to cast aspersions on people, many of whom just have legitimate questions about the vaccine that they haven't had answered yet. We certainly understand that and are doing our best to try to communicate to them effectively. My number one message to people who aren't sure about the vaccine is please talk to your doctor. Talk to your healthcare professional who knows you wherever you go to get medical care or your children go to get medical care. Please talk to those people, to that man or woman who cares for your family, and ask them what you ought to do. Ask them for the best recommendation you have about getting vaccinated. We think that that's the best place to get that information. So those are just some kind of prepared comments I had there, and be very happy to answer questions or talk about whatever you'd like. Yeah.
Dr. Harris, I've heard anecdotally from some people who might be hesitant to get the vaccine, who say they have talked to their personal medical professionals and they may not be getting the information that you're providing or the CDC is providing. Have y'all provided any educational opportunities or any outreach to Alabama doctors on the personal level about how they might be able to best address hesitancy issues?
Yes, I mean, we've done tons of it, and it may not be immediately apparent to the public because we do reach out to providers individually, but I have done regular and routine calls with them for a year and a half now on COVID. We have a Facebook Live event that, is this Thursday afternoon that we will continue to do weekly for providers, sponsored by the Medical Association and Hospital Association. We've sent out our what we call HANS, or Health Alert Network, messages that go to all healthcare providers. The most recent one was 3 or 4 days ago. We've done those routinely throughout the last year and a half. I think it's certainly true providers are like everyone else. They get their information from different places, and sometimes we don't know if we're reaching every provider, but that's provider education is a big part of what we do. Our provider group partners have worked with their own constituencies, so people like the Medical Association, the Alabama chapter of the Academy of Pediatrics, the Family Practice Association, many different groups like that. Our schools of public health, for that matter, all of them are carrying our messages to providers.
Dr. Harris.
Yeah, I say, let me go to the room here, and then I'll come to the phone next. Just one second.
Sorry. What are some of the biggest reasons that you're hearing of why people aren't getting the vaccine?
I think there are a lot of reasons people aren't getting vaccinated. There's not one reason. There are about as many reasons as there are people. Certainly, we recognize that there are some people that just don't have access to care. In Alabama, not everyone has an existing relationship with a provider, and if you don't have a doctor and don't have someone who knows you and your family, you may have a very simple question that many of us could get answered in 5 minutes with a call to the doctor's office, but that's just not an option for some people. And so some people just don't have access to care. I think there's hesitancy for many different other reasons. Most of the people I've heard who express hesitancy have really good, smart questions, but they just haven't got information from the right place yet. There is a tremendous amount of disinformation out there, misinformation, and even disinformation. If you get most of your news from social media, there's a high likelihood that you may not be getting the story correctly, and that's why we want to encourage people to reach out to providers. There are certainly people who have reasons to mistrust messages from the government, or they have reasons to mistrust messages from the media, or they don't trust public figures who are speaking on that issue. There's a lot of political partisanship, at least in some corners, as you know, that has helped people make up their minds about the vaccine, which is unfortunate. So again, I think our message would be, if you're not sure, please talk to your doctor. If you don't have a doctor, please talk to us in public health. We'll give you the best advice we have. You see, I'm going to go to the phone. I'm sorry, and then I'll come back to you. Yeah, there was a question on the phone.
Yes, sir. This is Joseph Moore, NBC 15 in Mobile. I have a question for you. We're seeing another rise in cases with this Delta variant that is more easily transmitted. Now, there's no mask order, and the population, a huge portion of the population, don't want to get the vaccination. Now, the personal responsibility message doesn't appear to be working. Where do you see the case counts and hospitalization headed, and how can we stop it?
Yeah, right now, I think the case numbers are not going the direction we would like. I think clearly we're seeing daily increases in our numbers of cases and our number of hospitalizations, and I think inevitably we're going to see increased numbers of deaths. I'd say we're spending all day, every day, and most every night trying to figure out how we can do that. I think we've learned, even when we had a mask mandate, people who aren't going to wear masks aren't going to wear masks, and when we've had other restrictions, people certainly felt free to flout those. And so it is challenging to know how to get people to change behavior. Ultimately, all we're trying to do is get people to change their behavior to make a choice about something that's a little bit healthier and a little bit safer. That's the whole bottom line of what we're trying to do. And we are pushing every button and pulling every lever we can, but what works for some doesn't work for others, and it's just difficult to reach some people. Yeah, here and there. You see? Go ahead.
Is that the reason there's no mask mandate from the state? Is that the reason you all don't want to go back to that?
I'm sorry, I need you to ask again. I didn't quite catch it.
I was asking, to the answer of the question I just asked you, is that the reason you all are not going back to the mask mandate for the entire state?
I think Governor Ivey's been very clear about that. This is a time for people to make the right decision. We think they have the right responsibility. It's challenging to know if the mandates even affect people's behavior, to be honest with you. And so at this time, I don't see any way that we would do that. So here in the room. So.
Dr. Harris, CDC is also expected today to require to recommend universal masking in K-12 schools. If we don't do that as a state, won't that leave a lot of rural school systems to possible outbreaks?
I think we expect we're going to see outbreaks. Every single school district has the ability to do that, and we are recommending that they do that. CDC has already issued guidance on schools about masking in schools. That's actually not new. That's been out for 2 or 3 weeks, and our school toolkit is going to represent, it's going to say exactly the same thing. We agree that that's a very effective way. For those kids who are old enough to be vaccinated, or for those faculty, staff, and administrators, vaccination is really the most important way to prevent transmission in schools. here in the room. So.
Okay, so my question is, there's been made apparent that there is a shortage of nurses. Is this something that you have seen? How bad is it? And do you think this is causing concerns in the hospitalizations?
So we've certainly heard that. I can only speak for public health. We've even with the additional federal support that all states have received, we've had a very difficult time recruiting people to work for public health, and nurses in particular. It's just a tough job market out there right now. I know that we certainly heard that from hospitals. I think that we know enough about the disease now. We do have some therapeutics that we can use to treat people. We have vaccinations which can prevent a lot of disease. I think our hospitals are in a much better place than they were a year ago, but I think I'll have to say my whole professional life, hospitals have struggled with staff shortages. That's a difficult issue, particularly in a state with the resources that we have. Yeah.
Yesterday, Dr. Williamson with the Hospital Association said that if we keep continuing with these low or stagnant vaccination rates, that it really gets to be a herd immunity issue, and that can take months and months and months. How worried are you about that, and what's that prognosis if these numbers keep rising, especially with the Delta variant?
Well, look, I mean, we're going to get the herd immunity. It's just a matter of how we do it, and we prefer to do it with vaccination. We prefer not to do it with people getting infected because we know, a couple of, 2 out of 100 are going to die, 10 out of 100 are going to be hospitalized in people who are infected. I think what's most worrisome is that because we have this new variant, the model on what herd immunity looks like is changing. And we've done these calculations before. A great deal of work has been done by Dr. Judd at the Lister Hill Center for Policy at UAB on herd immunity. I think you all are familiar with her work. Originally, we were using these benchmarks of 70% or maybe 75% of people with some type of antibody coverage. That number now looks more like 85 or 90%. Again, that's just a model. We don't know. But the more transmissible a variant is, the easier it is to spread to other people. The more people you're going to need to have protected in order to break this transmission. So, and then finally, I'll just say, every person who gets infected becomes a little factory for new viruses, and some of those viruses have the chance to be even more infectious or even more deadly. And so we need people to protect themselves. We need people to get vaccinated, because every single person who gets infected potentially could start the next wave of the next variant. So, yeah.
Doctor, speaking of vaccinations, when you hear reports that Alabama ranks last in the country for getting vaccines, how does that hit you?
I mean, it's really disappointing. We've had so many people do so much work on this for the past year and a half, and we are really doing our best to give Alabamians the best advice we can, to encourage them and cajole them and try to convince them that we're giving them answers that will keep them and their family safe and healthy. And it just feels like people aren't getting the message. They won't get the message sometimes. So it's discouraging, but it doesn't change what we have to do. Our job is to keep fighting the good fight and trying to convince people to do what we think is right for them to do. So, yeah.
Dr. Harris.
See, just once they get here in the room, and I'll go to the phone next.
We talked a little bit about this yesterday on vaccine incentives. Gadsden and some other cities are offering their own incentives. Gadsden actually offering $100. What has been your recommendation as far as a statewide incentive program like that? And what is your experience with your counterparts in other states on how much they move the needle on vaccination?
Yeah, I mean, incentive. Let me answer your second question first, Cam. I would say we're certainly not opposed to incentives at all. However, I don't know of an incentive program that's been wildly successful anywhere. And I've talked to, I have calls each week with every person in my job in the country, actually, and we have, other calls with people in our region, a few times during each week. Incentives are, they're real hit or miss, and it's hard to find an incentive that motivates everyone. You would think $1 million lottery would really change numbers. In Ohio, I think, had a 9% increase in vaccinations for about a week, and then it leveled off in spite of the fact they were still giving $1 million a week for a month. They're, ranked where they ranked before. So I don't know what incentive would work. However, we're okay with incentives. We've had a number of discussions, however, with our legal folks and with the Attorney General's office over what we actually are able to do, and there's limitations there. It's not an excuse, it's just a statement of the truth. I think as a smaller municipality, reaching out to people, if they have a legal framework that supports their ability to do that, then more power to them. At this point, handing cash to people in order to induce them to get vaccinated is just not going to be an option for us. I mean, it's just not allowed. So let me go to the phone there.
Dr. Harris, this is Kelly Smith with WHMT News 19 in Huntsville, Alabama. When we talk about PPP, rapid COVID tests, things that were all obstacles a year ago, where is the state now with those things?
Just in terms of testing capacity, do you mean, or?
And supplies, we had issues with PPE and things like that. Do we, as the cases rise due to the Delta variant, or do we have enough supplies in order to meet, testing demand and supply demand in hospitals?
I would say, generally speaking, we feel pretty good about the position we're in now. Normal supply chains have resumed. Things like PPE and even, therapeutics and so on that were, sort of having to be routed through the health department because of scarcity are being handled by healthcare facilities in the normal, through the normal acquisitions process in most cases. I think, again, you don't know. You can always, imagine a situation that overwhelms all your capacity, but that's really not our biggest concern right now. I think PPE or testing supplies or even, for the most part, the therapeutic agents are pretty widely available for everyone. I don't think that's an issue for us at the moment.
Dr. Harris?
In terms of hospitalizations and death, I don't know if you'll have the data on this. Is there any significant differences in demographics of the age, the race? Obviously, you said the unvaccinated people are making up the majority, but are there any other changes in demographics that y'all are seeing?
I think the main difference is that we are seeing our age numbers drift down a little bit. Older people have a much greater chance of being vaccinated and are much more likely to be vaccinated. Younger people, much less so, and so our case numbers show that the age is drifting down a little bit, and that's going to be reflected in everything we see. I don't have it in front of me, but I think when your largest number of cases are occurring in younger people, that's going to be reflected in your hospitalizations and to some degree your deaths, even though on average, obviously, younger people are less likely to die. One thing I sort of overlooked, and I assumed somebody would ask about it, but we are doing our best to track vaccine breakthrough cases. That can be a little bit challenging to do. Sometimes it's kind of it's a very manual process, trying to match up who's been vaccinated with the case numbers that we get. But right now we've identified 3,250 vaccine breakthrough cases, and that would be defined as someone that's completed their vaccine series, whether it's a one-shot J&J or a two-shot mRNA vaccine, and then it's been at least 2 weeks since they did complete, so that they're assumed to be fully vaccinated. These 3,250 people represent actually about 0.2% of the fully vaccinated individuals that we know about. Again, it's certainly, we don't love all the data there and think that we're giving you the most precise answer in the world, but to the best of our knowledge, that's the numbers that we have. Of these people who are fully vaccinated and became infected anyway, about 119 of them have been hospitalized and 30 of them have died. That's an incredibly low number. I think you can even see, we have always told you that when we have cases of COVID-19, we get around 8 or 9, maybe 10% in the hospital, about 2% or a little more who die. You can, just doing the math in your head there, you can see those numbers are improved. People who are vaccinated and yet are unlucky enough to get infected anyway tend not to be hospitalized as much based on this preliminary data, and they don't die as often based on that preliminary data, completely consistent with what we have thought all along. So,
Dr. Harris?
Yeah.
This is Shirley in Huntsville.
Hi.
I was the one who talked about the breakthrough cases. Can I talk about that a little bit more?
Sure, please go ahead.
I talked to public health leaders, hospital leaders in North Alabama yesterday. 10% of those with COVID in Huntsville hospitals are fully vaccinated. More than 16% of Decatur Morgan hospitals are fully vaccinated. A dentist in Huntsville shut down his practice this week because 3 of his healthy, fully vaccinated hygienists are now sick with COVID. These are people who wear masks every day at work. So my question is about the fully vaccinated. Are you seeing investigating breakthrough cases at dental medical practice? How is the state actually handling that based on what you said earlier? Are the breakthrough cases in the state, is there a common denominator? Did they take the same vaccine? Are they all immunocompromised? Or is there something I'm missing here? Are you collecting, posting data on that? And what is their message to be vaccinated?
Sure. So, yeah, those are all great questions. I'll tell you, in terms of the breakthrough cases we know about, again, I think it's very important to, again, put it into perspective. We have always known and expected there would be breakthrough cases. These vaccines were reported as being about 94% effective. They were nowhere near 100% effective. A 94% effective vaccine is about as good as any vaccine we have. And yet, a full 6% of people can get infected despite being fully vaccinated. We vaccinated, fully vaccinated almost 1.6 million people, and so 6% of that number is a lot of people. And so we're certainly going to hear about breakthrough cases. Nevertheless, in spite of that, as I said a moment ago, we have actually only identified about 0.2% of cases that are breakthroughs among those who are fully vaccinated. So we, maybe we're undercounting, maybe some of those breakthrough cases just aren't sick enough to come to attention. And overall, vaccination still protects against serious illness and death. The more people you have in our state who are vaccinated, the more people you're going to see who eventually end up being a hospitalized person or even a person who doesn't survive, because that's the pool of people out there able to be infected. The Delta variant clearly has the ability to infect people in a bigger way than the variants we have seen before. That's the basis for CDC's imminent announcement about mask guidance. It's just the Delta variant can spread much more easily to other people. A lot has been made about the Cape Cod study, the Provincetown, Massachusetts study you've probably seen, but the July 4th weekend they had over 500 cases associated with that holiday gathering. I think almost 70% of those people were vaccinated. Now most of them do well, but again, when you have a really highly infectious variant out there that's easily transmitted, there is some risk whether you're vaccinated or not. The message that you ask about for people who are unvaccinated is, please get vaccinated because you're much less likely to get sick or die if you're vaccinated. That still stands.
The message was for the vaccinated.
I'm sorry?
The message was for the vaccinated.
For people who are vaccinated, again, remember, even vaccines don't make you bulletproof, although they significantly lower your risk of serious illness or death. Yeah.
This is Eddie Burkhoff with APR. I think I may have not been clear about my last question about masking. So the CDC is going to likely recommend later today that universal masking in K-12, regardless of the vaccination status. Will the state change its guidance to reflect that if they make that call?
Our guidance is going to follow what CDC has said. I think we're waiting to see what that guidance is. We're delaying the release of our toolkit because we anticipate new guidance. So yeah, I think I don't want to comment on it before I've even seen it, but I think in virtually all cases we've followed the recommendations of CDC on that. Yeah, okay.
Dr. Williamson told me yesterday that our pediatric hospitalizations were up into the 30s. What has been the experience so far on the Delta variant with children, and the fact that most children can't get vaccinated? Is that part of the argument that the unvaccinated should take the shot?
Yeah, sure. So the question has to do with the pediatric population and the Delta variant. I'll answer, and then I think Dr. Karen Landers is on the phone. I might ask her to weigh in on that as well. We do know that I think we have 30 or maybe a little more than 30 pediatric cases hospitalized across the state with COVID, at least one infant that I'm aware of. I think if nothing else, surely that serves as a message to people who haven't decided yet about whether they want to get vaccinated. I think we hear from a lot of people who go, well, if it's my choice not to get vaccinated, then even if I infect someone else, well, it was their choice not to get vaccinated. And I think that overlooks the fact that we have a lot of Alabamians who don't have a choice about whether to get vaccinated. Everyone under age 12 is not eligible to be vaccinated. We also have people, for example, like organ transplant patients who perhaps we can vaccinate, but we know the vaccine doesn't work well for them, and they may not have a choice, so to speak, about whether someone exposes them and infects them. And for that matter, with the Delta variant, even vaccinated people can be at risk somewhat. So we hope that this pediatric data will at least help people understand that their actions do affect other people. Dr. Landers, if you're on the phone, do you want to comment any more about particularly the Delta variant and pediatric population?
Yes, Dr. Harris, and thank you for this opportunity, and thanks to everyone for asking these important questions. As a pediatrician myself, and also someone who communicates regularly with pediatric hospitals in Alabama, including our pediatric infectious disease specialists, we absolutely do not need to minimize the effect of COVID-19 on children, certainly in the group under 18 years of age. We know that we've had at least 108 children in Alabama develop the multi-system inflammatory syndrome of childhood, with more kids under investigation at the moment. We also know, and I think this is a very important fact to look at least in an international study that looked at outcomes for children, that up to half of children who have COVID-19 can have short-term side effects after having COVID that can last for several weeks. And at least 6% in one particular study indicated that long COVID did occur in children. We do know that with COVID-19, one of the complications of COVID-19 in children and also in adolescents, the disease can be myocarditis. So I think that any potential concerns about risk of myocarditis with vaccine, keep in mind that the risk of myocarditis from COVID-19 disease is much higher than the risk of any potential rare side effect with this vaccine. So we absolutely must protect children. And I think the children under 12 years of age are so vulnerable, not only in terms of getting disease, but also their own risk of transmitting this to other people who might have less optimal outcomes. Thank you so much, Dr. Harris.
Karen, thank you for that. And let me just reiterate that, with the Delta variant that we have circulating right now, if you get infected, you're probably going to infect 3 or 4 other people. I mean, that's just what the numbers show. So, who are those people going to be? Are they in your family? Are they your grandparents? Are they your kids? Are they people that you work with? We really need people to get vaccinated. We've really got to put a stop to this disease circulating.
Dr. Harris, this is Luke Hydash at Wayford England News. I'm in Huntsville. We've heard from a lot of people here in North Alabama who've gone to Tennessee, say, to get their vaccine. Is it possible that enough people have gone to other states to get their vaccine earlier on when they were eligible before they were here, perhaps, and that's why vaccination rates are so low here?
Sure, I think that plays a role for sure. We do have data sharing agreements now with our surrounding states. We're actually able to access the federal information. I think Dr. Sherry Davidson's here, our state epi, and she can correct me if I get this wrong. But I think we have tens of thousands of doses that have been administered in other states. I saw something yesterday from the state of Georgia. I think there were around, I may get this wrong, but about 18,000 doses that have been administered to Alabama residents in Georgia. Does that sound right to you, Sherry? Do you know? I'm sorry, I'm putting you on the spot there.
I'm not sure about Georgia specifically. I know in North Alabama we did see a lot that have gone to Tennessee as well.
Yeah, we have had thousands plural of doses, and in some cases 10,000s of doses given to Alabama residents in other states. We recognize that that's, in some cases, just the way people obtain health care. I'd say the real obvious example has been Russell County, Alabama, Phoenix City. Many people go to Columbus, Georgia for health care there. That's just the natural lines of travel there. And so we've, the vaccinator of Alabamians outside of Alabama has been the area around Columbus, Georgia. So. Let's see, I had just a couple other items. I was looking back through these questions. I'd gotten these questions from Liz Hurley in Huntsville, and I don't think I completely answered everything. Just for information, common denominators on breakthrough cases. We've seen, out of our 3,200 cases, we've seen about 426 of those in J&J recipients, about 972 in Moderna recipients, 1,852 in Pfizer recipients. Those are all not unexpected in terms of what we know about the effectiveness or efficacy of the J&J vaccine. You're a little more likely to break through if you got J&J. However, our hospitalization numbers are the same percentage for all. All three of those vaccines still protect extraordinarily well against serious illness, and equally so.
Dr. Harris, this is Mary Scott Hodgin with WBHM. Curious how the current surge is impacting nursing homes or long-term care facilities. I know the vaccination rates are higher there, but do you expect any new restrictions there? Are you seeing any outbreaks?
Yeah, well, we have not seen a lot. Our surveyors who work with nursing homes have, had to do these sort of focused infectious disease reviews of nursing homes from time to time when they've had outbreaks. We've actually not had to do that for a few months, although I think we just maybe had to do that within the last 2 weeks at a certain facility. They do continue to see some cases from time to time, inevitably. However, they've done a terrific job of vaccinating their residents. Well over 90% of their residents are vaccinated. They're not at 100%, mostly because they just have turnover. They have people coming and going, but by and large, their residents are almost all vaccinated. I would say among their staff, we don't have an easy way to track this, but it's reported to us that their staff is not particularly well vaccinated on the whole. The numbers are more reflective of the state of Alabama, actually, and so probably less than half of staff are fully vaccinated, somewhere in that range, although I don't know that actual number.
Dr. Harris, this is Alan up in Birmingham. Going back to masking, we're expecting the CDC to make that order. What would you tell fully vaccinated people in the general public why they should return to masks? Also, what would you tell those in schools fully vaccinated why they might need to return to masks? Our people up here in Jefferson County worried about peer pressure and bullying if there was a difference.
Alan, I would say it's not a huge change from what we've been saying. I mean, it is a little bit more explicit guidance in a way. And again, I would say we really hope people can appreciate the nuance that when the science changes because the real world situation changes, then the guidance is going to change a little bit. But we have always said for unvaccinated people, please get vaccinated and please consider a mask in most situations when you're outside your home. For people who are fully vaccinated, again, I would remind you that we have a much more infectious variant circulating. So for an added layer of protection, for extra security, especially if you're vulnerable because of your age or your chronic health problems, masks make a whole lot of sense. And if you're going to be indoors, if you're going to be mixed with people whose vaccination status you don't know or people you know to be unvaccinated, then I think I would wear a mask, and I would recommend that others wear a mask in those situations. In terms of schools, again, I think we want to see exactly what the guidance is before we comment on it, but we generally have been very supportive and followed CDC guidance on schools as well as everything else. And I don't think there's a huge change in our guidance, except there may be situations where fully vaccinated people, may have the recommendation to wear masks. So I expect we'll adopt that once we see that. Okay. Yeah.
Dr. Harris, the state has been pretty blunt about urging people to get vaccinated, but at the same time, the legislature passed this so-called ban on vaccine passports that would prohibit businesses and others from denying entry and services to unvaccinated or charging them more or putting them as a different section. Did the department have an opinion on that legislation, and do you think it's hindering the effort in any way, either through direct incentives or mixed messaging? Sorry to get into politics.
Yeah, I don't think you're very sorry to get into that. Kim, that's a terrific question. You know, I would just say, you know, that we play the hand we're dealt. You know, the legislature has in its power to create these rules. They don't feel that we ought to be asking about vaccination status, so we're just trying to do our best to take care of people any way we can. That's really all I have to say about that. Okay. Any other questions? All right. We have considered doing these again, you know, weekly for a little while or whatever. Just let us hear from you. If this is helpful and you want us to, we will. If it's not, that's doesn't hurt our feelings. But we just want this to be a time for you guys to get information. So just let us know what you would like. Thanks everybody for joining us.
If any of you guys use the interview